As the highly contagious Delta variant fuels a rise in hospitalizations and a 65% jump in new COVID cases, mostly among the unvaccinated, it's also fueling an about face. Many GOP leaders are suddenly speaking up forcefully in support of the vaccine. The Republican governors of Alabama, Missouri, West Virginia, and Florida are all stressing the need for more vaccinations, but stopping short of stricter COVID protocols. Well, one GOP lawmaker has been a vaccine cheerleader all along. Congresswoman Mariannette Miller-Meeks of Iowa joins me now. She's a member of the GOP Doctor Caucus and was director of the Iowa State Health Department. So she is certainly an authority on this matter, a politician, also a doctor. And let's start, Congresswoman, put your doctor hat on for a moment. Given the rise in cases and hospitalizations, would you support new mask mandates for vaccinated Americans or a vaccine mandate for federal employees?
Well, I think first and foremost that people need to be aware that there's vaccines available, where they're available, how they can get them. And we need to make sure that they're just not in certain clinics, but in all doctors' offices, hospitals, pharmacies, and settings where they can be readily accessible and available. At this point in time, there is a rise in cases, but we're not to the level we were before. And if we can remember back, it may seem a long time, but back to a little over a year ago, when we started having people shelter at home and lockdowns and requirement for masks and social distancing, it was to reduce and prevent a surge and overwhelming our hospital capabilities. So we're not at that level yet. We certainly have learned how to better treat people with COVID-19, how to reduce hospitalizations, how to promote better health in our members. And we've also learned risk factors, which we did not have at the beginning of this pandemic. So at this point in time, I would continue to encourage people to get vaccinated. And I would be very honest and forthright with them about what risks are available. If there is information they have, answer their questions. I think shaming people and blaming and denigrating them, ridiculing them for not having yet been vaccinated does little to help promote people to get vaccinated. So you're right. I take off my congressperson hat and I put on my doctor's hat, which is why back in March, I went to all 24 counties in my district attending vaccination clinics and administering vaccines to people.
So, and I see what you're saying, that the numbers, although they have risen, they're not as bad as they were earlier in the pandemic when hospitals were just overwhelmed with patients. That is happening at certainly fewer hospitals in this country right now. But just to go back, do you support new mask mandates for vaccinated Americans or a vaccine mandate, or do you believe it should still be optional?
So you said, do I support a mask mandate for vaccinated Americans? No, I think if people are fully vaccinated, so they have either both shots of Pfizer or Moderna or a single shot of J&J. So if they're fully vaccinated, no, I do not think that there should be a mask mandate for fully vaccinated individuals. But I do think if people are concerned or if they have medical risk factors that put them at greater risk or they have a weakened immune system, then through their own personal health risk factors, medical risk factors, they may want to wear a mask. There is some breakthrough. There are individuals who are vaccinated, who have been double vaccinated, who do contract COVID-19, the Delta variant, but the breakthrough is extremely small. So the last study I read was about 0.05%. So you could get COVID-19 if you're fully vaccinated, but the risk is extremely low. So no, I would not recommend or suggest a mask mandate for those people who are fully vaccinated.
And same for vaccine mandate for federal employees. Just want to be clear on that.
I'm not for vaccine mandates, and the reason is that this is an injectable substance. It's a medicine that we're putting into people's bodies. I think if you can be honest and forthright with people, let them know to check with their doctor if they have concerns. Try to get information, clear guidance and information from the CDC would be tremendously helpful. And that includes adverse reactions. It includes risk, which we still don't have a good risk benefit analysis from the CDC regarding the vaccines, but overall highly effective, very safe. Decades of research went into the making of these vaccines, even if the vaccine came to the public very rapidly. And I think those things are very important for people to know. Also, when you look around the world at over the numbers of people that have been vaccinated, the numbers of people that have been vaccinated in the United States, you can look at the very low risk of side effects and compared to the risk of your side effects if you get COVID-19. And this includes a long-term risk. So I know young people who have contracted COVID-19 and for 6 to 9 months have lost smell, taste, have had low-grade headaches, and some have had fatigue greater than their, a usual fatigue that they may have. So there are long-term side effects from COVID-19, side effects from the vaccine, much less. So it's safe, it's effective, and I certainly would continue to encourage people, if they have not been vaccinated, to get vaccinated, but to talk with their doctor, talk with someone who they have a trusting relationship with in the medical field, where they can have their questions answered about being vaccinated.
I want to get to the CNN report from this past week that shows nearly half of House Republicans refuse to share their vaccination status. Why do you think so many members of your party are not saying if they are vaccinated or vocally encouraging the vaccines?
Well, I can't answer for my colleagues why they don't want to address their vaccine status. But what I can say is that when you look at who's more persuasive in getting people to get vaccinated, is it an elected official, regardless of at what level or tier, or is it someone with medical experience? So people trust their doctor or a nurse practitioner or a PA, someone in their family with medical experience, more than they would a legislator. So I think what's even more important is that we in the medical community continue to make ourselves available, answer questions, even if it's on a virtual format or if it's a radio talk show, that we make ourselves available to be able to answer questions to people and let them know that certainly they can contact their provider to get any questions answered about if they have vaccine hesitancy, the risks, the side effects. There is some information that is erroneous, and those errors can be helped corrected if they contact their provider. So I think it's most important that we, in the medical community, make people aware that we're available to them. We want to be there for it. We're not going to shame them. We're not going to blame them. We're not going to denigrate them, but we want to be able to answer questions for them, clear up any misconceptions they may have, and also reassure them about the safety of the vaccine. There are people who are genuinely concerned that this is, it's something medically drug that you would inject into your body, and it only has emergency use authorization. It doesn't have full authorization from the CDC. And myself and other members of the DOC caucus have actually sent letters asking in support of getting full authorization, given the numbers of vaccines that have been given here in the United States and also around the world, to use that
really quickly,
real-world evidence.
Before we wrap up, as we run out of time, I want to talk about the political polarization, the U.S. versus Canada. You're seeing much higher rates of conservatives in Canada getting vaccinated versus right here in the United States. Last night at a rally, former President Trump told his supporters he recommended the vaccine, but then he said, quote, "I also believe in your freedoms." Would you like to see him do more?
Well, it's interesting you say that, because early on when President Biden came into office, Press Secretary Jen Psaki was asked a question about should President Trump get credit for the vaccine development coming to the market in 9 months. And she said no. This was a tremendous opportunity for bipartisanship and putting the nation above political differences, for them to say yes. And we encourage President Trump to come help us to encourage people to get vaccinated.
But why isn't he? And
so I'd like to see
the Trump,
all of us
the Biden administration
I would like to
has,
see all of us do more in order to get people vaccinated. We know that it's a way that we can
Let me
get
just
through
jump
this
in really
pandemic.
quick.
President
President Biden
Biden
himself has given Trump credit when he was getting vaccinated. Of course, the criticism has been, it was it wasn't enough. He hasn't said enough. He hasn't been forward enough. But what about Trump? Would you like to see him be out there more promoting the vaccine that he helped with under Operation Warp Speed?
I think certainly any of us who are in a position to be able to influence people and to make a message that the vaccine is safe, that it's effective, there were no safety shortcuts in getting this vaccine to the public, that it was built upon decades of research and so far has a very good safety protocol, and that it's very effective and also effective against the Delta variant. I think that's a message that we can get out to people, continue to encourage people, and then be available to answer their questions.
Okay, Congresswoman Mariannette Miller-Meeks, thank you very much for joining us.
Thank you so much, and have a good evening, Pamela.
You too.